Welcome to the Cardiovisual app. My name is Michelle Routhenstien, and I'm a registered dietitian, a certified diabetes educator, and a preventative cardiology dietitian. Today, I'm here to speak with you about nutrition and kidney disease, primarily kidney disease from stages 1 through 4. One of the most important things we can do to stop the progression of chronic kidney disease is to manage our blood pressure and our blood sugar levels. Our blood sugar and our blood pressure is best managed through nutrition and lifestyle medicine, along with medications as necessary. The reason why it's so important that we focus on making sure our blood pressure and our blood sugar is optimal is because when they are high, it puts an extra burden and an extra load onto the kidneys, causing more blood vessel damage in the kidneys and therefore causing acceleration of the worsening of our kidney function. Please refer to the other videos in the Cardiovisual app on how to manage hypertension and diabetes. Our kidneys do a lot of things for our body. It removes waste products, excess electrolytes, and fluids from our bodies. So we need to make sure that when we are looking at our nutrition, that we are helping to reduce the burden that we're placing on our kidneys to prevent the acceleration of chronic kidney disease. For instance, when we consume protein, particularly animal protein, one of the byproducts of the protein is ammonia. And our kidneys cannot remove excess ammonia if our kidney function is not optimal. So depending on your stage of kidney disease, a protein restriction would probably benefit you. The research also shows that when we look at protein, all protein is not equal. When we have protein from animal sources, it also increases a metabolic acid load, which also puts strain on our kidneys to do more work and also progress the worsening of renal disease, which we are trying to prevent. Every person's protein restriction will depend on their lab parameters and the stage of chronic kidney disease they are in, but generally speaking, about 0.6 to 0.8 grams per kilogram of body weight is advised for use. So that's approximately 2 to 3 ounces of protein at each meal for a woman or a man who weighs about 150 pounds. Normal kidneys remove excess phosphorus into the urine. When our kidneys are not functioning optimally, our body might not be able to remove as much phosphorus out into the urine, so it stays in our blood. I would highly encourage you to know your lab values and speak with your personalized care team to see if you need to have a phosphorus restriction. When phosphorus accumulates in our body and we have high phosphorus levels, it causes an impairment in bone metabolism, leading to weak and brittle bones, and also can cause calcification in the arteries, leading to a severity of heart disease. If you require a phosphorus restriction, it's important to look at the different sources of phosphorus, but also understand that the absorption rate is different in different sources. So for instance, phosphorus is found in a lot of natural food sources like meats, grains, nuts, seeds, and dairy products. But it's also found in a lot of processed foods. So the phosphorus found in processed foods is 100% absorbable, meaning when you consume it, your body is absorbing all of it, and that can lead to that extra phosphorus in your blood, harming your bone health and your kidney health. Whereas if you get it from natural foods, the absorption rate significantly decreases. So for instance, when you have it from natural dairy, it's absorbed about 80%. When you have it from meats and nuts, it's about 60%, and it's absorbed 40% from grains. So that's really important to understand when you're making those decisions of which phosphorus foods you're consuming and in what quantities. When we talk about phosphorus additives, I'm talking about anything that's in the nutrition ingredient list that contains the letters PHOS. So things like phosphoric acid or disodium phosphate or sodium polyphosphate or tricalcium phosphate. If it has the PHOS in the nutrition ingredient list, that is something you should try to avoid because the absorption rate will definitely increase the phosphorus in your blood. I'd also like to emphasize that many times when our phosphorus is elevated, it might cause a lower calcium level, please do not take a calcium supplement unless it is recommended by your physician. It's also important to note that there are many supplements that can do a lot of harm to your kidneys. So please do not take any supplements without first verifying with your nephrologist and care team. A lot of supplements get filtered through your kidneys, and if your kidneys are not optimally functioning, it will lead to toxic amounts of that supplements to stay in your body versus being excreted out. This can harm your kidneys and lead to dangerous amounts of these supplements in your body that can do a lot more harm than good. Another key electrolyte that your kidneys help to remove when we have excess of is potassium. And if we have chronic kidney disease stages 1 through 4, our body might not be able to excrete as much potassium through our urine, so it builds up in our blood. The potassium restriction is only warranted if your blood values are high in potassium. So please consult with your doctor to see if you need this restriction. Oftentimes, when someone has a high potassium level and they're required to go on a potassium restriction, the doctor will advise them to remove all beans and legumes, nuts, fruits, and vegetables from their diet. And we've seen that kidney disease is very interrelated with heart disease. And if we remove these very powerful nutrients from our diet, we can actually do more harm for our blood vessel health and our gut health, which we do not want. The importance is that there's a lot of low potassium fruits, vegetables, nuts, and seeds that you can incorporate into your diet in a healthy way to ensure that you're protecting your kidneys and your heart health. Some of these include things like cucumbers, celery, eggplant, cabbage, arugula, kale, pineapple, blueberries, strawberries, apples, pears. There's a lot of things when it comes to fruits and vegetables that you can include in a heart-healthy kidney diet. In terms of nuts, it's really about quantity. If you have half a cup of any nut, it's going to be high in potassium. But if you have an ounce of almonds or an ounce of pecans or macadamia nuts, the threshold of potassium is actually pretty low, and you can still include it healthfully in your diet. Another key thing I like to include here is that when we have too many meat products or refined cereals, we increase our metabolic acid load, and that accelerates kidney disease. When we have things that reduce this metabolic acid load, like fruits and vegetables, we actually slow down the worsening of renal function. So it's important that we don't eliminate these heart-healthy foods. We just need to make sure that they can fit in your diet based off of your lab parameters and your need for these restrictions. Your kidneys also regulate blood pressure and remove excess sodium from your body. So it's important that we do look at restricting salt intake so that we do not put that extra burden onto our body and increase the high blood pressure, which really accelerates chronic kidney disease. Generally speaking, we want to limit sodium to about 1,500 milligrams per day. And sodium is found in many foods, such as your processed foods, your frozen foods, your convenient foods, your restaurant foods, and the salt shaker and what you put into your own cooking as well. It's important to note that people with chronic kidney disease should not depend on a salt substitute. The salt substitutes often contain supplemental potassium, which can then cause other complications such as high potassium levels. And high potassium is something we are trying to avoid because it can lead to heart attacks and death if the level is very high. Instead, I recommend fresh herbs and spices to flavor your food, such as black pepper, garlic, turmeric, cinnamon, parsley, and so forth. Your kidneys also help remove excess water. And depending on your stage of chronic kidney disease, you might have some fluid retention. So in those cases, you might benefit from a fluid restriction in order to assist your body with the edema and the swelling that is going on. please consult with your doctor if a fluid restriction is necessary. Usually it's about 1 liter plus your urine output. So depending on how much you're urinating, that will also determine your fluid capacity as well. In summary, I want to make sure that we are doing what we can from a nutrition and lifestyle perspective to prevent the progression of chronic kidney disease. The first thing that we want to make sure is that if you have high blood pressure or you have diabetes, that it is optimally managed and your numbers are within normal range. The second is we want to make sure that you are not adding too many things that cause a burden or a toxic load onto your kidneys. For instance, excess protein or excess phosphorus additives can lead to an extra amount of phosphorus and an extra amount of ammonia to be in the body, leading to a burden on our kidneys and an acceleration of chronic kidney disease. If you have the need to go on a phosphorus or potassium restriction, please make sure that you are not eliminating nuts, seeds, fruits, and vegetables from your diet, because chronic kidney disease and heart health are very interconnected. You just want to choose lower potassium options and lower phosphorus options from natural food to ensure you're getting the nutrients you need, but also protecting your heart and kidneys at the same time. I hope this video was helpful to you, and I look forward to seeing you at the next one. Remember, this is all general advice. Please consult with your nephrologist, cardiologist, and primary care team to ensure individualized, personalized care for optimal results.